In this video we are going to look at transudative and exudative type of pleural effusion. We have already covered the clinical features and investigations for pleural effusion, for which link is available in description. Now let's dive into how we are going to find out whether pleural effusion is transudative or exudative in nature. It will also help us to rule out different causes. Whenever there is increase in hydrostatic pressure, as in congestive cardiac failure, renal failure, or there is decrease in plasma oncotic pressure as in cirrhosis or nephrotic syndrome, pleural effusion is said to be transudative. On the other hand, infection as in pneumonia, parapneumonic effusion, TB, fungal infections or inflammation, malignancy, autoimmune conditions or esophageal rupture, in fact all those conditions when inflammation of lungs leads to increase in capillary permeability, will lead to exudative effusion. In lab we use light criteria to differentiate the two. We will measure the levels of protein and LDH both in serum and pleural fluid. If ratio of pleural fluid protein to serum protein is 0.5 or less, effusion is transudative. When more than 0.5 it is exudative. The next point in light criteria is LDH levels. Ratio of pleural fluid LDH to serum LDH, if it is 0.6 or less, effusion is transudative. If ratio is more than 0.6 it is exudative. The third thing is pleural fluid LDH levels. If pleural fluid LDH is less than 2/3 of upper limit of normal serum LDH, effusion is said to be transudative, otherwise it will be exudative. We have covered the light criteria to differentiate the transudative pleural effusion from exudative. Now if we do the pleural tap, there are some points on physical examination that will help us to differentiate the two. Transudative effusion is clear in color, does not form froth or clot. On the other hand, exudative effusion can be cloudy, straw-colored, or even hemorrhagic. It can form froth when shaken. And when left standing it will form clots. Now other lab investigations like glucose level, specific gravity and pH of pleural fluid will also help us to differentiate the two. That is all for today. Thanks for watching.